Namaste, dear friends. My name is Prasad, and today I'm here to discuss with you the stiffness of hip area, hip joint, hip socket, and how can we work on that stiffness by doing some very simple movements and yoga asanas. Generally, it is seen that people have a lot of stiffness in their lower back and the gluteus area or the hip area. I'm going to show you a sequence of 4 movements plus posture that can help you relieve this area out of your stiffness, make it a little more flexible and a little more supple. The first movement that we do is sit on your mat or your carpet, sit on your sit bones, these are two bones that stick from your hip area, and keep your feet as wide as the mat. Sit with a straight spine, just like I'm sitting right now. The neck is parallel to the floor, and then gently bring the left knee in, left knee up, right knee in, right knee up, left knee in, left knee up, right knee in, right knee up. What we are doing here is we are mobilizing the hip socket, the bone of the hip socket. See to it that your spine remains straight, you don't move your upper body, and you're just moving this. Doesn't matter if your knee does not reach the floor, that is not at all the issue. The point is to just mobilize the hip socket. Do this 10 rotations for each leg. Once you finish doing that, bring your feet together, join your feet and sit in something as we in yoga call it as the Baddha Konasana, the bounded angle. If you can see from the side, my back is straight. Doesn't matter where your knees reach. We are just working on opening the inner thigh area. So if you see from the side, you will be this way. Now I'll show you from the front. I'm sitting straight once again on the sit bones. I'm joining my feet, and then you hold your big toes or your feet together and gently place your elbows just around your knees, and very slowly you can press your knees gently, exhale and try to bend forward. Very gently press the knees, exhale, try to bend forward. Very gently press the knees, exhale, try to bend forward. Be sure to not put some impact on your hip joint, hip socket. No violent movements like this. This joint is very, very susceptible to injuries because of our sedentary life and bad postural habits. And that's why it's very important to take care while we are doing this movement. Once again, if it's difficult for you to reach the foot, just hold your foot like this, both your feet with hands. Keep your elbows around your knees. Gently push, bend forward. Gently push, bend forward. Gently push, bend forward. This was the second movement or asana. The third movement or asana is the Gomukhasana or the Cowface posture. What we have to do is we have to keep the right leg down this way and sit again on the sit bones. Then take the left leg and place the left knee somewhere on the top of the right knee like this. If it's this way, it's fine. If you're a little more flexible in the glutes area, it will be like this. This is also okay. If you are stiffer in the glutes area, you'll be something like this. That's also fine. Don't force yourself. Try to be as comfortable and as centered as possible. Let's assume you are very stiff in the hip area and your flexibility level allows you only to reach till here. What do we do then? We just hold our feet, ankles especially, in our hands, and gently as we inhale deeply, As we exhale, we bend forward. Inhale, exhale. Inhale, exhale. As you keep moving lower and lower, it's going to stretch the gluteus area more and more. Sometimes it might get a little painful. So be sure to be aware and stop when it's starting to hurt too much. You should be in the discomfort and not in the pain. Keep breathing. Allow yourself to breathe deeply, 8 to 10 deep breaths. And then come out gently. And then gradually, easily shift or switch the legs. Like this. Now sometimes it is seen that one side is a little stiffer or more flexible than the other one. Let this not bother you. This happens to many of us, that our sides are not balanced, especially flexible. But see to it that you don't force your expectation on the other side which is weaker. So you hold your feet, inhale, exhale, forward bend, inhale, exhale, forward bend, inhale, exhale, forward bend. Once you reach your maximum physical limit and maximum discomfort limit of the mind, stay here and breathe and gently pull out of the posture. Now we come to the last one, the fourth posture in this whole sequence of hip openers. I'll show you from this side angle. It's a very simple posture. Sit in a cross-legged position, once again adjusting yourself on the sit bones. Keep both your hands on the floor. See to it that your spine is straight as much as possible. If your hip is tight, it's going to happen that your lower back also is generally curved, but doesn't matter. What you do is try to lift up your spine as much as you can and gently crawl or move with your hands and allow your head to come lower and lower and lower, and allow yourself to rest like this. This is a fantastic gentle stretch of not just the hip but also the lateral thigh. Now if you are very stiff in this part, this area, it's going to happen that you might reach just till here. That's fine, that's okay. Try to do with acceptance, try to stretch with awareness. That's all it takes to move ahead and transform yourself in the asana practice. So let's look at it once again. Let's do the recapitulation of all the four postures. The first one was alternate bending of the knee. So we keep the feet apart and gently bringing the knees inwards and out, inwards and out. You can do anywhere between 8 to 10 repetitions. The next one was, we went into something called as the Baddha Konasana or the butterfly. You hold your feet, you gently keep your elbows next to the knees, and slowly with the exhalations bend forward and try to open gently, consciously your inner thighs. The third one was a posture that we called as Gomukhasana or the cow face posture, keeping the right leg down, left leg up, stretching the hip, keeping the spine long, and gently, as we saw it before, breath by breath, bending forward, and then we come out and then we switch the sides, not bothering much about the difference between flexibilities, just accepting it and working with acceptance, gently with exhale, bending forward. And our last stretch was a very gentle seated position, the cross-legged position as they say, and extending slowly, bending forward as much to the level as we can. Hope that helps you work on your hip, not just the hip but also the lower part of the spine, generally which gets disturbed and crunched because of a bad sitting postures and long hours of sedentary lifestyle. So hope that helps you, my dear friends. Hope that helps you relieve your backache and get over the stiffness of your hip and your lower spine. Thank you. Namaste.